New York.
All right, Ida, some good advice there, and we know there are so many questions about the coronavirus outbreak, so we asked you to send yours to us so we could get those answered for you.
Dr. Robert Amler has been here all afternoon answering your questions on Facebook Live. He's the Dean of the School of Health Sciences and Practice at New York Medical College and a former top CDC official. Dr. Amler joining us now with some more of your questions. Thanks so much for coming in today to talk about this.
Thank you for having me.
These are questions that have come in on our website and on our NBC4 New York app. I'll start with this one. We talk about patients with coronavirus having existing conditions, a lot of the ones that have ended up in fatal cases. Can you clarify what prior medical conditions would make a patient more high risk? For example, dialysis patients, heart conditions, HIV, would they be more at risk? And if you're a healthy person, are you at risk?
Sure. Well, Stephan, we don't know exactly which conditions these people had. We'll probably eventually find out, but for family and privacy reasons, we haven't been given that information, at least not publicly. But in the meantime, those conditions you mentioned, things that patients would know they have, altered immunity. It could also be people who are taking certain medications for other conditions that may not be that serious, but those medications suppress their immunity. And those patients will know who they are by and large. So if they're in that category, they should be even extra careful, and so should their family members and close friends, not to expose them to anything.
So when you talk about preventing it, that's what everybody wants to know. How do we not get this, right? Well, we saw in Mark Santilla's package all the supplies flying off the shelves, okay? The masks, that's a big one.
Yep.
Talk about why the general public shouldn't be wearing those masks.
Well, we know that the masks, the paper masks themselves, are not effective at protecting the wearer from somebody else's germs. They're designed the other way around. They work the opposite direction. They protect other people from the wearer's germs. So if you're a surgeon or a surgical nurse or an ICU nurse, you don't want your germs to get on the vulnerable patient that's in front of you. So you wear a mask to block your own droplets from landing on somebody else. If you're worried about somebody else's droplets, that mask is not effective. Too much room around the sides, and it's not it's too porous that it allows droplets to get through in many cases.
And you said our medical professionals need those. I heard you say that earlier.
And that's the other issue, is if you buy up too many of those masks, as our Surgeon General has said over the weekend, you're going to deprive important supply lines from being continued, so that hospitals and emergency personnel get the masks that they need in order to protect themselves, but also to cover the patients who are being investigated, so that they don't spread their germs.
No, it's good to think of it that way, in those terms as well. Dr. Amler, thank you so much. Dr. Robert Amler, the Dean of the School of Health Sciences and Practice at New York Medical College. Thank you for your expertise and for answering our questions.
Thank you so much for joining us in our coronavirus coverage.